It's some 29 minutes after 8 here on the AM show. Now, Graphic Business in partnership with Stanbic Bank presents the Graphic Business Stanbic Bank Business Breakfast Meeting. The theme is Deposit Insurance, a catalyst for stronger banking industry. Is tomorrow, 6th of February 2018 from 7 a.m. The venue is Omanya Hall, Labadi Beach Hotel here in Accra. Speakers, Dr. Ernest Addison, Governor, Bank of Ghana, Nana Otue Champong, banking consultant and head of Osei Tutu Center for Excellence, Education and Research. And then Mr. Seth Asante, his partner, Benti Enchil Lechan and Kuma, and head of Financial Institutions and Capital Markets Practice Group. To participate, you can please call Joyce, and the number is 0244 266 006, 0244 266 006, or Trewa on 0243 957 399. It's 0243 957 399. Or you can even send an email with your details to joyce.yenube@graphic.com.gh or yvonne.ie@graphic.com.gh. You can also register online at www.graphic.com.gh. This event is sponsored by Graphic News App and Labadi Beach Hotel. Media partners Joy Business and JoyNews. And tomorrow we will be at the Labadi Beach Hotel live to bring you not only a live coverage of the events, but the AM show is also going to be live from there. So you've got to stay tuned in. Is the Graphic Business Stanbic Bank Business Breakfast Meeting. If you want to be there at the Labadi Beach Hotel, kindly send an email with your details. Call any of the numbers that we've given out. And then the speakers rolling on your screens now at the Labadi Beach Hotel tomorrow at 7 a.m. Make sure that you join us. Graphic Business, setting the business agenda. Now, yesterday, 4th of February, was World Cancer Day. We've had the conversation several times on the show. I think what is alarming is the fact that the numbers keep going up, is rising. Lots of people die every day because of cancer. But we put the spotlights just a few times on children. So we thought today, let's talk about childhood cancers. And I've got just the right person to have the conversation with. George Achampim is country representative, World Child Cancer, and he joins us for a conversation. Good morning to you.
Good morning,
Thank
Mama
you
V.
for coming.
My pleasure.
Yeah. This is really your area. So I'll leave you to tell us. So one of the things, because if you look at what we are celebrating, it's not, we're not celebrating, we're observing. We observed the day yesterday. And one of the issues that came up was the fact that we don't even have data. So when it comes to children, how are we collecting this data? How are we tracking children with cancers?
That is the major challenge, and especially so in our country. However, some data are available. They are institution-based data. When you talk about data on population health, usually the focus is on population-based data. That helps with planning and then designing of interventions.
Okay.
In the settings where you don't have them and the only available ones are institution-based data, you rely on them, but that does not give you a very good picture of the situation in the country. In Ghana, as we speak now, we have about 700 children who are currently receiving treatment for cancer, and 300 children are diagnosed each year. Let me add.
In Ghana?
In Ghana.
The 300 is in Ghana?
I'm home. Yes,
okay.
We're talking about home.
But this is just those who report to the medical facilities.
That's what I want to add. Whenever I mention the figures, about 300 reporting, I add that it's only 1 out of 4 that report and get diagnosed and receive treatment. So if we should estimate per our population, we can say that we have 1,300 to 1,500 children estimated to develop cancer each year. And it's 300 that are diagnosed each year. So it means we have about 75% of the children out there who are not being diagnosed at all, and for that matter, not receiving any kind of treatment and are likely to die painful death.
Wow. Are they walking around knowing what is happening to them, or they don't even know? Parents just know that their children are not well.
Most parents know their children are not well, but parents do not know it's perhaps they are suffering from cancer. Because even those that get diagnosed, we have at least 6 out of 10 parents visiting 4 different hospitals before they are finally diagnosed. This tells you that the journey, even the detection journey, is so long.
Do we know why? What happens?
Because there is generally low levels of awareness among the general population and even among some healthcare professionals, because there are instances where we have parents complaining that we suspected something was wrong, and the healthcare professional tells the parent, well, they'll grow out of it, especially with cancer of the eye in children. Retinoblastoma, that can easily be detected if you observe any white spot in the eye of the child, or even if you should take a shot you should take a picture with your phone and it has flashlights behind it, and you observe that there's a white spot in one of the eyes and the other is red, it could be the beginning of cancer. And most parents, when they take their children for weighing clinics or child welfare clinics, they complain and sometimes report to the staff on duty, I suspect something is wrong, and then they say, well, they will grow out of it. But the unfortunate thing is, as the children are growing, the condition is also growing, and it's often detected late. And it's a huge problem in this country, because many of those that are detected, it's only about 30% that survive as a result of low levels of awareness among the general population and some healthcare professionals. Once they are detected late, only a few survive. We have about 30% surviving, which is not good. So that's how come we are so grateful. We have the opportunity to talk about it, because these children don't have a voice. And in most cases, if something happens to a child, the child will report to the parent. And if the parent does not appreciate that what my child is experiencing could be something more serious, then they are not likely to take the appropriate action or to seek the medical help that is needed.
But we also talked yesterday about the fact that there are very few specialists. And I can't believe that there are just 5 specialist doctors for children in this area.
Yes, children with cancers. In fact, the 5, thankfully, the figure changed to 5 in August 2017.
Oh, so that's thankfully.
Before, just last year, before August 2015, we had only 3 in this country. And there are only 2 treatment centers across the country.
For children?
For children with cancers.
Okay.
It's Komfanochi and Kolebu Teaching Hospital.
So I guess the 5 spread between Komfanochi and then Kolebu?
Yes, 3 at Kolebu and 2 in Kumasi.
Wow. It means that if your child is diagnosed, then the only place really you can take them is Kolebu or Komfanochi. Is that correct?
And these are the places where they can be diagnosed. The other centers will only suspect and do referrals. So that is why it's very good that parents should get to know at least the early warning signs of cancer, so that if they are reporting to a particular facility for treatment for suspected condition for a sustained period of time. Often people do manage malaria in children for over 3 weeks, 4 weeks, then it means something is wrong. Perhaps it's not malaria. It's difficult to pick cancers in children because the early warning signs are very similar to some of the commonly known conditions. That is why you cannot just look at a child and say, well, I suspect this child. So there are signs that we always ask parents to look for, and especially in this very month, we are doing education. We are running a month-long campaign because while the 4th, yesterday was World Cancer Day, the 15th is International Childhood Cancer Day.
Okay.
So throughout the month, that's what we do. We are sharing information on the early warning signs of cancer, and every day there's a teaser For example, today we are saying that every lump or any lump on any part of the body of a child could be a sign of cancer, whether painless or painful. So if a child should report that, well, something, I suspect there's a swelling here, and and the parent asks, is it painful? And the child says no. Then they say, well, perhaps it's not something serious.
Should it be painful?
Whether painful or not.
Okay.
It could be.
But my fear is, if you took the child to the closest clinic, they might not be able to diagnose right.
Yes. That is the situation in this country. So what we are doing is, what child cancer does in this country is to train more healthcare professionals. Apart from these two centers, each year we invite mainly healthcare professionals who work with children to workshops in the southern sector and also in the northern sector. Usually in May, we organize it in Accra and invite healthcare professionals from other regions to join, where we pick a specific childhood cancer condition and delve deeper, train people on so that it will help with their early detection, because that's what we need to do.
Is there any financial support? Because I know that taking care of cancer patients can be in fact, it is expensive.
Yes, it is expensive. Financial support, what we have now, it's not sustainable. You cannot leave your health care financing to donors to help. That is not sustainable. Or what Child Cancer is doing in Ghana now, and there are other individuals and other organizations in country that also do support childhood cancer treatment. Some donate money to the treatment centers to be used. There are some that target it and say, well, we have specific number of children we want to support them with. And so yes, there are some pockets of funding, but I'll tell you it's inadequate.
So World Child Cancer, do you have a certain fund that a parent can come and get support from?
Yes, we have fund, and we work directly with the lead doctors who are doing the treatment. So though when I mention, people say, well, it's small. It's
How much
small.
Is that? How much?
How much is that? We are talking about what we have. If you have like £3,000 to support children in every 3 months, it's too small. But there are other things we are doing, because the lists, I mean, some of the conditions they wouldn't take much to cure, but even with those that are less expensive, it's around, let me say, 2,800. There are conditions that can take you, for example, if a child is diagnosed of leukemia, based on the sex, whether a boy or girl, it will take about 3 years to 3.5 years to treat that child. And you spend sometimes in the region of 300,000 Ghana cedis. Is it 300? No, sorry. 350,000 Ghana cedis. That is, formally 350 million. So, and then, or 300,000. Look, and most families cannot afford this. It's not most families, majority, I mean, per Ghanaian standard. So the more sustainable form of financing will be having childhood cancer treatment covered under the National Health Insurance. It's very ironic. We have breast and cervical cancers. Women are very powerful in this country because you have breast and cervical cancers covered under the NHIS. Prostate cancer is not there. And we have institutions. We have the non-communicable disease control unit. There's a unit under the Ghana Health Service that's supposed to also be doing lots of public education, but they are also not. They also cry for funds. So if you have this condition, that information is scarcely available, and only a few of the population are aware that these conditions are there, then we need to take proper action.
Yeah. All right. We have to come back and visit this conversation proper on the 15th when the spotlight is put on children. But is there a website, if somebody watching us and has a problem, at least needs some, because I think sometimes that's just all you need, somebody to talk to see the way forward, apart from the doctor. Yeah. So yeah.
Yes, there are parents. There's the Ghana Association of Parents with Cancers.
Okay.
Because you need very good social support. So this is what that body does. We have one in Accra, one in Kumasi.
Okay.
There's a website. World Child Cancer has a website. The Ghana, they call it GAPAC. The Ghana Parents Association for Childhood Cancers also have a website.
Okay.
So you could.
So people can just Google World Child
Cancer
and get in touch.
And get in touch for this piece of information. When you go to our website, there's a section for Ghana. So everything you need to know about childhood cancers in Ghana, you can access it online.
Okay, all right. I want to say thank you so much for your time. Thank you for being here. George Champion, was there anything else that you wanted to add to our conversation?
The only thing there are a few things I want to add. I always say that if you should observe that your child, for example, if your child passes urine and you see droplets of blood in it, it could be the beginning of cancer of the kidney in a child. Any white spot in the eye could be the beginning of childhood cancer in the eye. Any lump, any swelling on any part of the body, parents should please seek prompt attention.
Okay.
Because there is hope for childhood cancers. If detected early, 8 out of 10 children who develop cancer can be cured.
Okay. All right. And I'm going to get in touch so that we get the daily dose that you were talking about. Today is on the lamps. We'll see what tomorrow would be on, and then we can broadcast it for every parent to see. But thank you so much for your time.
You're welcome.
On the show this morning.